Many people think diabetes appears suddenly. But for most people with type 2 diabetes, it develops gradually over several years. Before diabetes begins, there is often a warning stage where blood sugar is higher than normal but not yet high enough to be called diabetes. This stage is known as prediabetes, and the good news is that it can often be reversed. So what exactly is prediabetes? Prediabetes is a condition in which blood sugar levels are consistently higher than normal but not high enough to meet the criteria for type 2 diabetes. It is a sign that the body is beginning to have difficulty controlling glucose. Normally, after you eat, the pancreas releases insulin, allowing glucose to move from the bloodstream into the body's cells. In many people with prediabetes, the cells gradually become resistant to insulin. To compensate, the pancreas produces more insulin to keep blood sugar under control. At first, this works well. But over time, the pancreas can no longer keep up with the body's increasing demand for insulin. As a result, blood sugar levels slowly begin to rise, leading to prediabetes. Most people with prediabetes have no noticeable symptoms. That's why many people don't realize they have it until a routine blood test detects higher than normal glucose levels. Some people may develop dark, velvety patches of skin, especially around the neck or under the arms, which can be a sign of high insulin levels. Several factors increase the risk of prediabetes. These include being overweight, lack of physical activity, unhealthy eating habits, family history of diabetes, older age, high blood pressure, and a history of gestational diabetes. However, prediabetes can also occur in younger people and those who are not overweight. If left untreated, prediabetes can progress to type 2 diabetes, increasing the risk of heart disease, stroke, kidney disease, nerve damage, and vision problems. However, not everyone with prediabetes develops diabetes. The understanding of prediabetes has improved greatly as scientists studied insulin resistance, metabolism, and the early changes that occur before diabetes develops. This research has shown that intervention at this stage can significantly reduce the risk of future disease. The good news is that prediabetes can often be reversed. Healthy eating, regular physical activity, losing excess weight when needed, getting enough sleep, and managing stress can improve insulin sensitivity and bring blood sugar back into the normal range. In some cases, doctors may also prescribe medication for people at very high risk. Today, artificial intelligence is helping doctors identify people at risk even before diabetes develops. AI can analyze routine blood tests, electronic health records, wearable device data, physical activity, sleep patterns, and family history to estimate a person's likelihood of progressing from prediabetes to type 2 diabetes. Some healthcare systems also use AI to recommend personalized lifestyle programs based on each individual's risk factors and progress. Prediabetes is an early warning sign that the body's blood sugar control is beginning to fail. Recognizing it early provides an opportunity to make lifestyle changes that can delay or even prevent the development of type 2 diabetes. But high blood sugar isn't the only danger. In our next video, we'll explore hypoglycemia explained and discover what happens when blood sugar falls too low for the body to function properly.